So here's a child, and you can see that he has a goiter. Thyroid hormone disorders include something called myxedema, which is caused by hypothyroidism in adults. And it results in physical and mental sluggishness. And then we have Graves' disease, caused by hyperthyroidism, which results in increased metabolism, heat loss, or heat intolerance. That is, you just feel warm all the time. A rapid heartbeat, weight loss, and exophthalmos. That is, your eyes kind of bug out a little bit. So I've got a couple of pictures here that show each of these conditions. Here's Graves' disease, and you can see here the exophthalmos that occurs. The eyes bug out. This is a result of fat deposition behind the eyes, and when this happens, it really does not change. You can have your thyroid gland disorders taken care of, but you're still going to have the big buggy eyes. And this is myxedema. So you've got fluid buildup, you've got a thickening of the tissues, coarseness of the hair. Hair also gets a bit brittle, and just sluggish thinking. Now, calcitonin, it decreases blood calcium levels by causing it to be deposited in bone. This is just one factor associated with bone deposition, by the way, because calcium metabolism is very convoluted. It requires a lot of specialized situations. But calcitonin is antagonistic to the parathyroid hormone, and it is which are produced by parafollicular cells. And the parafollicular cells are found between the follicles. So here we've got the different follicles. We have parafollicular cells located within that area. So parathyroid glands, these are tiny masses on the posterior of the thyroid, not very big at all. And when people have thyroid problems, they want to, if they have surgery to remove the thyroid, they definitely want to leave the parafollicular cells. Nowadays, they will use irradiated iodine instead, which will go in and it will bind to the thyroid gland, but not the parathyroid gland, and it will destroy the cells of the thyroid, but not the parathyroid. In any case, the parathyroid hormone stimulates the kidneys and intestines to absorb more calcium, so it will raise the calcium levels in blood. Calcitonin, on the other hand, decreases the calcium level in blood. Calcium is important, and I missed this, I apologize, but it also causes osteoclasts to remove calcium from bone. We have to maintain a certain level of calcium in our bloodstream for all sorts of things to work. Muscles don't work properly without calcium. Our heart doesn't beat properly without calcium. Our blood doesn't clot properly without calcium. So having a proper calcium maintenance is extremely important. Now we have the adrenal glands, and these sit on top of the kidneys. And there are two regions, the adrenal cortex and the adrenal medulla. So the adrenal cortex produces mineralocorticoids, glucocorticoids, and some sex hormones. Let's take a look at what these do. Again, I'm not going to ask you what is made by the adrenal medulla. You should know the difference between mineralocorticoids, glucocorticoids, and sex hormones. So let's talk about those. There's a graphic just showing you where the adrenal gland is located. And let's talk about the mineralocorticoids. Mainly aldosterone, and it's produced in the adrenal cortex. It regulates the mineral content in blood. So it helps regulate fluid and electrolyte balance. So if you are usually put minerals into the urine, which draws more fluid out. So that's how it regulates the water balance as well. Now, the target organ is the kidney, and its production is stimulated by renin and aldosterone, and its actions are limited by atrial natriuretic peptide. So generally, this hormone is associated with retaining fluid. Atrial natriuretic peptide actually is produced by the heart when there's too much fluid in the bloodstream, which is causing a pressure on the heart or a strain on the heart. It will release atrial natriuretic peptide, which will make you pee out extra fluid. So again, these two are kind of antagonistic to one another. Now, the glucocorticoids, which include cortisone and cortisol, which are anti-inflammatory, but they're also stress-related hormones. So this is produced in the adrenal cortex. They promote cell metabolism, but they help resist long-term stressors. So for a short-term stressor, you will have the release of adrenaline, which will cause a big burst of energy. But long-term stressors, you'll get this cortisol, which causes a couple of different things to happen. An excess of cortisol will actually result in degeneration of muscle and deposition of fat in the middle part of the body. So it is released in response to adrenal corticotropic hormone, which is produced by the pituitary. So you've got the stress or stressor of some sort, which signals to the hypothalamus, which actually regulates a lot of emotional conditions, to cause a release of this adrenocorticotropic hormone to the adrenal cortex, which then causes a release of the catecholamines, which include epinephrine and norepinephrine, but also the release of cortisol for long-term stress management. Other hormones of the adrenal cortex include some sex hormones, mostly androgens, which are male sex hormones. Now, these are produced constantly, but when women go through menopause, the estrogen and progesterone, which have been countering the effects of these androgens, are no longer there, and as a result, the androgens take over, and that's why you see older women who develop mustaches, for example. Other adrenal cortex disorders, there's Addison's disease, which results from hyposecretion of adrenal cortex hormones. It also causes a bronzing of skin tone. Muscles are weak, you get burnout, and you're susceptible to infection. So President John F. Kennedy actually had Addison's disease, and people really didn't pay attention or didn't notice it because he had this bronze skin tone, so he always looked young and tanned and healthy, but he was actually very, very sick. Hyperaldosteronism, or Cushing syndrome, results when you have can result when you have a tumor in the pituitary, which is causing a release of adrenocorticotropic hormone. You end up with a lot of water. You end up retaining water and sodium, which can lead to high blood pressure and edema. Now, here's that bronzing of skin that we see with Addison's disease. Here's that bronzing as well. And this is a person who just looks like they've worked out in the sun and have a good tan. But this would be the normal skin color if they did not have Addison's disease. Adrenal cortex disorders include Cushing syndrome, which results from a tumor in the middle cortical area of the adrenal cortex. And Addison's disease has specific characteristics of there being a moon face and a buffalo hump. The upper back kind of gets a hump on it. You get high blood pressure, hyperglycemia, weakening of bones, and depression. Also, you can get from an excess of the secretion of sex hormones, masculinization in women. So beard and male distribution of hair growth can occur with women in this condition. Here's a kid with Cushing's syndrome. And if you looked at that child and saw him in public, you'd probably just think, what terrible parents for feeding him so much. But he just has this condition which is causing him to retain fluids. Now, fortunately, this is treatable.